So our speaker today is Carolyn Parsey. She is a neuropsychologist in the Memory and Brain Wellness Clinic at Harborview Medical Center with the University of Washington. And she always does fantastic work, but she's been doing some special work in the era of COVID, really focusing on folks with dementia and their caregivers. So I'll let you, Carolyn, take it from here. Thanks so much for coming to speak to us.
Yeah, thanks for having me. And congratulations to all of you who are graduating. What an exciting time. So today I wanted to talk to you a little bit about what's been going on in the dementia care world during COVID-19 and how especially what we have been hearing about from our patients and our care partners, our families in our clinic and elsewhere about how they've been dealing with this and what their concerns have been and what things have been working and not working. And so that's what I'll be talking about most today. So first I'll give you the latest and greatest COVID-19 figures for our older adults in Washington State. And then go more specifically into some practical recommendations. A lot of them are geared toward care partners, thinking about our folks with dementia who are in need of more support and are no longer really living independently. I'll tap on some hot topics, which are communication and how to really talk about COVID-19 and pandemics, hygiene issues and hand washing, coping with the social isolation and quarantine aspects, how to make sure that our caregivers are still cared for, so the respite care and thinking through some of the self-care practices, and then some of the things that have been discussed in long-term care and how they're dealing with the virus and management as well. This is a very nice and handy one-pager from the CDC. This is a PDF if you're interested in downloading it for some of your patients or posting it in the clinic. So here are the numbers as of yesterday, or 2 days ago, I guess, is when they were last updated. So this is what things look like here in Washington. We are seeing a lot heavier hitting areas actually down, especially in Yakima area, has been hit pretty hard in the past few weeks to months. Whereas, as you've heard, a lot of King County, things are getting a little bit better around here, to be determined as things have started opening up. The breakdown for demographics is also really important, especially considering we're talking about geriatric populations, which are at higher risk. So our older adults are experiencing the worst outcomes of COVID-19 and a much, much higher mortality rate. So even though our confirmed cases here for 60 to 80-year-olds, right, are really only making up, less than a third, when we start to look at hospitalizations and ultimate mortality, those numbers get very distorted. So our older adults are definitely at a higher risk. On a national level, folks 60 years old or older are at 80% of the COVID-related deaths nationally. In Washington State, it's actually even a little bit higher than that. We're talking about 90%. So very, very high. If you want to monitor any of this, all the data is available on the Washington Department of Health website, and they have lots of good interactive dashboard for stats if you're numbers minded. So I'll first talk about how we've been encouraging our caregivers to talk about the virus with their loved ones with dementia. So we know that with dementia, major changes in routine can cause all kinds of issues, right? It brings up a lot of behavioral problems. It can bring up some mood swings and kind of that agitation in particular. We don't like to be knocked off our routine, any of us. I think we've all been a bit, can appreciate that, let's say, in the past few months. And it's particularly difficult for folks who don't have the kind of awareness or ability to understand what's happening right now. Some of the best things that our caregivers can do is really establish routine. I really like the Alzheimer's Association daily plan. This is a capture from online on their website, which is here. of some real concrete examples of how to create a day-to-day plan and a way to execute that. Simplification is another opportunity to create structure and routine. Or when they're giving information about the virus, what we've said and what seems to be helpful for our folks is to give only the amount of information necessary. Overloaded, too much detail, it's not worth it. That it just becomes more stressful. It may or may not be retained. So simplification of information, considering limiting how much exposure to news or really complex information that's being put out there to minimize stress, both for the person with dementia and also for our caregivers too. I've been encouraging a lot of my folks lately to just say, you know, once per day, check on the news. And maybe it's the nightly news, right, at 6 p.m. or something. Get the full recap rather than the overload that's been happening, and every 10 minutes we're getting some new information. There's a lot going on in the world right now, and we need to be mindful of that for ourselves and for our patients too. I've been very much engaging in a lot of MI, motivational interviewing techniques lately with some of my patients of trying to adapt to change. And I feel that rolling with resistance is probably the most salient practice right now. This idea that, you know, people can be in this ambiguous state of whether or not I want to go out or I don't want to go out. I want to order my groceries in. Should I do takeout? Should I not do takeout? Kind of all these decisions that we didn't have to think so hard about prior to February or March. And just to kind of roll with that and be okay with being in that ambiguous space and working through it slowly. Also coming up with just some supportive statements. So when our folks with dementia are starting to experience some distress or worry about maybe something they heard on the news or something they saw a headline in a newspaper, of having some good supportive statements in your pocket of saying that, you know what, we're doing everything we can to keep our family healthy. This is how we stay safe right now. That's why we need to stay home, right? So sticking to the point, simple, easy, and then because you know that it very well may come up again in an hour or two. So having some good stuff in your pocket is going to be helpful. Hygiene, right, has been extremely important. Giving extra reminders for hygiene has been somewhat beneficial for folks. So having notes on bathroom mirrors and things like that. Some of the practices that have been most successful from our caregivers' perspective have been just creating some sort of hand washing practice. So just every hour we're going to wash our hands, and they go and they do it together, or they do it, you know, the caregiver does it and then the patient does it. If that's becoming more of a battle, using hand sanitizer as an option of just like, hey, let's just, you know, rinse off our hands, and that's something that might be easier or more approachable. We've also heard a lot of really good creative strategies. I always love our caregivers for how creative they become, especially in crises. Some have talked about these implementing activities that just mimic hand washing. So putting a bunch of even not dirty dishes in some soapy water in the sink, and then just saying, oh, those need to be washed. Can you wash them? And then we're kind of washing our hands without actually washing our hands, right? So these creative ways of getting soap and water on our hands and scrubbing, and then being like, hey, and we scrub some dishes that may or may not have even needed to get done. Illusion of choice is something that can be helpful for those who are pretty resistant. So this is a way of creating choice where you still make sure that the task gets done. So in this case, if we're talking about washing our hands, you're given a choice. You can wash your hands with soap, or we can use sanitizer. Either way, that task is going to get done. So I'm not giving you an out that you can't. I'm just saying, which way would you like to do it, right? Masks have probably been the most challenging because it's hard to understand, why am I wearing this thing, right? I'm not used to this. This is abnormal. This is uncomfortable, especially as the temperatures are starting to get warmer. It fogs up people's glasses. We've probably all been experiencing some of this stuff. And what we can just say is that do the best you can. with reminders and with encouragement. And if there's a straight up refusal, go to your backup plan, right? Which is the good social distancing and keeping our distance, especially when we're in public places. Reducing trips outside the home is also a good way if we're really having trouble with mask compliance. I gave a brief talk on staying connected during social distancing a few months back. I think it was at the end of March, and it was one of the more fun and interesting talks I gave recently. And thinking about how creative people have been with engaging with people while we've been at home. And again, with routine, we can do things like every day at 3 o'clock, we're going to call our neighbor, or we're going to call our son every Friday, or, having some sort of set date and time, something to look forward to, and something that's part of a schedule is always good. I've been enjoying seeing the things that people have come up with. So a couple of examples, we've seen folks doing some read along. So if you have grandkids on the other side of the country, doing some sort of video or Skype type thing, and then reading to your grandkids over different platforms. This is a specific platform where kids can read on a tablet with with somebody in their family, and they see the same book. So there's lots of these really neat ways that people are connecting. The good old-fashioned letters and poems and short stories, not only do they take up some of that time during the day when we're kind of stuck inside, but they're a great way to connect, and they're a great way to express ourselves. Lawn conversations have come up of, somebody sitting on a porch and somebody coming by, and they're going to sit way out in the lawn, and they're going to kind of like talk to each other from 20 yards away or something like that, have also been an option. And then some of the really neat online groups and apps. You may have heard of the Sofa Singers, which is now I think it's about 500 people are coming together now to sing together over Zoom, which is pretty impressive. If you go to, I think it's sofasingers.com or .org, definitely worth checking out, if not just for a bit of humor in your day. Silver Sneakers has done some incredible work bringing a lot of their exercise routines, brief routines, 5, 10, 15 minutes of low impact exercise onto video platforms so folks can do them at home, especially with no equipment, which is amazing. And they're doing a lot of them for free still. And then lots of different videos and game platforms that are pretty easy to use. House Party has been really an interesting pickup of older adults, because you can do Pictionary live with other people. And I've heard lots of people enjoying doing that with their grandkids as well. This is another group. This is a group of older adults. This is a capture from a video. These are older adults who've been doing exercise out in their, 6 feet apart, but in their little cul-de-sac all together, and they do the hokey pokey or something, and they all do it together, which is just fun. Social exercise, 2 birds with 1 stone. And then making sure our care partners are taken care of. Their job is already possibly the most difficult job that I can think of. And now we're in even more difficult times. And we need to be really mindful of how much they're taking on, self-care practices and respite, planning that into their daily routine. Something that's been successful has been saying, I'm just going to get up 20 to 30 minutes before my loved one does. And that's going to be my time. Or it's maybe there's somebody at the end of the day where after my loved one goes to bed, those are my 30 minutes before I go to bed. And having some sort of regular practice. 5-minute distractors as well. So sorting papers, kind of busy work, where if you just need a 5-minute break to just walk away and reset, is just giving, the person with dementia something to do. And it doesn't necessarily have to be super productive, but just something to keep them busy, just for 5 minutes to go, breathe, reset, and come back in with a kind of a fresh look. A lot of the home-based care options have been coming up in our caregiver forums, in particular, of whether or not it's safe or not to bring my loved one home. I'm worried about possible exposure of the virus in their long-term care facility. Should I bring them home? Is that a better risk, worse risk? Very difficult to answer. I'll just be honest. I don't have a good answer because it's very specific to their situation. If they're at home and they're going to be exposed to a lot of other people, so there's people coming and going in the house all the time, somebody is still working, and so they're exposed to people at work and now they're coming home, that's going to be a higher risk scenario than two people who are elderly, retired, and no one's coming and going, right? But then you have to consider the capacity of the person who would then be taking on that role of caregiving if it's normally been in long-term care hands, right? So with home health workers, if that's becoming part of the conversation, really be careful about protocols, whether it's you're going to do a temperature check, whether they're exposed to anybody else, hand washing and masks. A lot of the home care groups have been doing specified protocols since COVID started. So this leads into a little bit of the long-term care facilities. Moving somebody out of a long-term care facility, if they're pretty well established there, can sometimes do a lot more harm than good. So we'll see folks where they've finally gotten into that routine, that structure, that familiarity of this place, and then to uproot them and move them can sometimes kind of increase a lot of symptoms. And then considering what level of care that person will need at home, and can the family or that potentially the spouse, adult child, can they handle that on their own? Often there was a reason why they chose long-term care, and that they're in that level of care, right? And so to bring them back sometimes can create a lot of stress for our at-home caregivers. Limited visitation, people have gotten creative with trying to be able to connect with loved ones, so whether it's phone or video calls, letters, cards, going to windows and having phone chats through the window. People have become more creative. And something I've just been encouraging everybody to do is just have a plan. In the event that a long-term care facility has an outbreak or the person with dementia becomes sick, have a plan in place. Have your emergency backup folks there. Be ready. So I'll finish with some available resources that we have as part of our clinic, and then also some that are broader. We've moved a lot of our caregiver support and other supports virtually, which is exciting because we've been able to engage a lot of folks from across the state and out of state as well. So these are a couple of things. This is our main link to where all of these things are housed. But we've been doing virtual coffee chats for folks with memory loss and dementia. They're happening weekly on Tuesdays. There's some of the upcoming dates, and then there'll be more in July. Our virtual caregiver forums, which are led by the one and only Karen Clay, our social worker who's on this panel. Those are happening on Mondays at 10 a.m. These are two of the more recent ones. There's plenty more. And then also the virtual community wellness talks. These are some of the ones that are coming up. These are happening on Wednesdays from about, the talk itself goes from about 1 to 1:30 with about 15 minutes for Q&A where attendees can ask questions. And we've also been archiving and putting all the previous talks online, both the PowerPoints and the Zoom videos. So you can go back and look at them. Caregivers can go back and look at them. Lots of practical ideas and recommendations that are all embedded in there. And then other good resources that I've been pointing folks to, the Alzheimer's Association has done an excellent job of creating a COVID-19 specific webinar series that's free. It just started last week. It'll be going through the first week of July at least, if they don't extend it. You can find more information on their website here. These are some of the topics that they'll be covering in the next 4 weeks. And these are free. You can sign up online. And then just in general, they have their COVID-19 websites more specific for folks with dementia and their caregivers of recommendations and practicalities. Always the 24/7 helpline from Alzheimer's Association is a fantastic resource. And then a couple of the other dementia or subgroups of dementia have also put together their own COVID resource websites. So those are there if you have folks with frontal temporal dementia or Lewy body dementia. they have their own coronavirus specific websites. I love to highlight Teepa Snow's work and how much she has put into a lot of her content for our caregivers, and what an incredible person-centered focus that she has, which I wholly appreciate and try to follow myself in terms of recommendations. And so her work is out there, and she has a really great video that she put out. I believe it was in March or early April, when a lot of the quarantine pieces were just starting. And it's a really nice 30-minute kind of interview video about really practical things to consider. Now, as always, our CDC website too, just for all the latest and greatest that's coming out of the numbers and what's coming next, or hopefully not coming next. So that's what I have for you. So thank you so much for your attention this afternoon.